So a couple of my go-tos for bruising from exercise and injuries, some natural things that you can try are Arnica, so Arnica montana, which is a homeopathic. You can get that at most drugstores or online, and that's just derived from a plant, so you can get that in a liquid or gel form and apply that topically over bruising. Usually helps pretty well. Other things I suggest are you can orally take pills such as turmeric, cumin, and also bromelain. And bromelain is also found naturally occurring in pineapples and some other things. So you can take tablet form of that to help with bruising. You can also just use ice, right? Pretty basic standard. 10 to 15 minutes. You don't need to do hours and hours and hours. It's not necessarily going to have a more therapeutic dosage to do it longer, but you could do it repeatedly. So icing, elevating also to help flush some of that stuff out. Taking an NSAID, so a non-steroidal anti-inflammatory, which will help to flush out again some of that inflammation and extracellular junk, so to speak. So something like Aleve, ibuprofen, Advil, that could also help. And then some other modalities that we have in physical therapy, sometimes we'll use, sometimes I'll tape a patient. I'll use either Kinesiotape or Rocktape, and I'll do what's called like an edema taping, which can be really, really helpful for bruising. And then other things that we have in physical therapy specifically would be ultrasound, which you can have on a pulsed setting to help flush out an area of bruising. You can also use light therapy. So there's a cold laser and a hot laser, and that's also considered light therapy. There's also other modalities. You could do electrical stimulation, like a TENS unit, and that with ice can be really helpful for bruising from an injury.